This is not an overnight story. This is really 8 years in development. After tireless work on behalf of our foundation, as well as partnership with the Canadian Foundation for Innovation, CFI, and really owing largely to the tremendous generosity of the donors here at St. Paul's Hospital, this has become a reality. This new 3 Tesla magnet is truly state-of-the-art. It'll have tremendous impact for all of the patients that we serve here at Providence Healthcare. We do thousands of MRIs every year for a whole host of conditions, but with 3 Tesla, we'll be able to offer more robust imaging of the brain, many of the musculoskeletal conditions that we image for, and in my area of particular interest, really innovate in the cardiovascular and cardiopulmonary spaces, having the first polarized gas imaging program west of Toronto and the first 3T MRI program in the Lower Mainland.
Some of the things that we can do with this 3T magnet that we couldn't do before with 1.5 include some advanced imaging techniques for things like bone and joint disorders, nerve disorders, and also high resolution imaging of the brain that we couldn't do before. One of the things we're most excited about is the advanced cardiovascular imaging techniques that we will do. We look after, as a tertiary referral centre, some of the most complex cardiac patients in the province, and as such require quite long examinations, sometimes taking 2 or 3 hours, involving multiple breath holds, often leaving the patients quite exhausted. With this technology, we can do single breath hold imaging that will really transform the quality of the imaging and the patient experience. Another thing that we're very excited about is the research opportunity that we have. For example, imaging of the lung is traditionally very difficult with MRI, but with our new hyperpolarized gas imaging, we'll be able to evaluate imaging of the lungs in patients with diseases like COPD, asthma, cystic fibrosis, not only to evaluate their disease progression, but also the impact of therapy and medications on their disease.